So, Grace Spence Green, delighted to have you on the Therapy Works podcast. Do you want to introduce yourself?
It's such a pleasure to be here, Julia. Thank you. My name's Grace. I am 29. I am a junior doctor living in London, and I'm also a wheelchair user.
And so, do you want to tell us what the greatest challenge you have had is? I ask all my guests that question. What is the greatest challenge you have faced or are facing?
I think when people hear about my story and my spinal cord injury, I think their initial thought is it must be that day, the day of the injury, and overcoming that. When I was a fourth year medical student, I was 22. I had 1 year left of medical school, so I was starting to really feel like I was nearing the end. I was traveling into London from a clinical placement, and a friend dropped me off at a shopping centre so I could get the tube to the Castle Climbing Centre where I coached kids climbing. And I remember walking down the atrium of the shopping centre, and then I remember waking up again on the floor, which was such a strange sensation to wake up when you hadn't fallen asleep. And I remember waking up, and I remember a lot of faces crowded around me, but I could sense that there was another figure on the floor, and there was a group around him. And I would find out later that this figure had jumped from the third floor of the shopping centre atrium and landed on my back, breaking my spine in a few places, one of which the impact damaged my spinal cord. So I was paralysed from the chest down.
It's a big thing. And how you started was some people would think that was the biggest challenge that you're facing. And also the years of rehab and being in hospital and being in pain and nerve injury and so much that went with that. And you're about to tell us it's not that.
Yeah, I think I find it interesting because people understandably, when they ask me about that, they think that I have a lot of traumatic memories attached to that day. But that feels like I'm telling a story of like someone else at this point, really. I think
It's like a third person story. It's like,
exactly. I feel so detached from it. I think what was much harder was then the 2 weeks I spent in acute care, and then 10 weeks I spent in a spinal rehab unit, learning to live as a wheelchair user again. Um, these things were all very difficult in their own right, but I think looking back, the biggest challenge for me was finding my own narrative to follow, forging my own path through being disabled. And that took many years and a lot more effort, I think.
I mean, I really want to unpick that with you because in some ways, what you're saying is that the physical injury is big and huge, but actually the psychological readjustment and realignment of how you can live with yourself and be with yourself in a way now that you're a wheelchair user. And you use the word disabled because I was interested whether you use that word.
Yeah, absolutely. I think part of my journey through this was learning more about other disabled people, disability justice movements, but understanding that for majority of the time I am disabled by my environment more than my wheelchair disables me. My wheelchair is a tool for independence and my autonomy. So I really don't, I'm very happy with the term disabled. And I feel like when at times people have hesitated to call me that or apologized after using that word, I feel like they are attaching a stigma to it that doesn't need to be there and ends up stigmatizing me further.
In some ways, I want to go through two streams. Can we name what you internally find difficult about now being a wheelchair user that's physiological and psychological? And then we can talk about how you're treated and responded to in that way makes it worse.
I'm really proud to be part of this community. I'm very proud to be disabled, but I had a lot of grief to work through
Young
after my
woman.
injury. Yeah, and I think it took me a long time to realize that my life didn't have to be just smaller now. But I think for the first year, maybe, it was just overcast in loss and everything I now couldn't do. And I think at 22, you're sort of imagining this new life for yourself, and that sort of all just fell away.
That your life, as you pictured it, had been
Yeah,
taken from you. Yeah.
completely. And it took a long time to realize that it would be no less full, this life, but a different life. But I think I still struggle with that, and I know lots of disabled people that do, is that I can feel really happy to be part of this community. I can feel proud. I can have really good days, but I still have difficult days of pain or like spasms getting in the way, spasms in my legs, and that can be quite difficult. But I've sort of realized that that won't last. These things pass, I think. I think at the start I'd get in these moods that would take weeks to get out of. Yeah.
One way of defining loss is that it's updating of your brain. It's like your brain is learning. It's almost like every time you had a spasm or you're in pain, what you'd previously learned or thought was this is going to last forever, and you feel overwhelmed. But over time, your brain learned actually it lasts for a few days or a few hours, and I can still have a full and active life. And so that when you could hold both, that expanded your kind of confidence in your capacity rather than narrowing it.
Absolutely, absolutely. And I was allocated a psychiatrist when I was in the spinal rehab unit. And he said something that I think is quite a common metaphor, but I'd never heard it before, about understanding grief as sort of your brain is a box, and there's a kind of pain button on one side, and there's, at the moment, you have this giant ball bouncing around, and it's constantly kind of hitting that button, and you feel these pangs all the time, but that over time, I think he said the ball gets smaller, but to me it felt like the
Box
box got
gets
much
bigger.
bigger. Yeah, exactly.
I think the theoretical term is accommodation, that actually the pain doesn't get smaller, but you build your life around the pain.
Yeah, completely. But it was really interesting to me. I felt like I could almost, especially now I can track the rough stages of grief I went through, and it did really feel like a grieving process.
And what helped you? What supported you through that grieving process?
I think I had such a good support system in the hospital, and it made me feel so just acutely aware of how lucky I was, because I was around lots of other spinally injured people that didn't have visitors come in, and didn't have, my parents and my partner came in every day for 10 weeks. So it was a strange time, because I wrote this down in my diary really early on. I almost felt like this is as close as I would get to witnessing my own funeral, because the outpourings of love from not just close friends and family, but people I hadn't spoken to in years were sending me messages and kind of reminiscing. It was obviously lovely, but it was also quite strange.
Intense.
Yeah,
Yeah.
exactly. So I think the support was excellent. And then actually later on, meeting other wheelchair users and connecting with them, and seeing their lives maybe 5 years on from their injury or their like becoming disabled, that really helped me to see through this.
Because there's a bit in your book where you met up with someone and you went in the woods, or you went out rambling on your wheelchairs together. So it's someone could show you a lived experience of how this can be and how I can live, and that I can still have fun. So I'm not walking in the woods, but I can have a lot of fun.
Completely. And I think it just struck me that I'd never seen that represented before in anything I'd watched in the past 22 years, or that I'd seen, I think. So it was so important to find that for myself.
And so from the other side, so that your kind of relationship with yourself, I imagine, is ongoing and evolving, both as a woman, as a partner, as a daughter, and as a doctor. I imagine there are things that come in and thwart you, and you have to find your way through them. But the things that thwart you is how we all kind of patronize disability and feel sorry for you and put our head to one side, but don't make the doors more easy to get through, don't reduce pavement so that you can wheel in and out. Tell me more about that.
Yeah, I think that actually is daily or is generally much harder to deal with and navigate.
Come to terms with.
Yeah. Exactly. Yeah. And that was a real shock when I first was discharged, because although I found the rehab space really incredibly difficult and painful at times, it was enclosed, it was safe, it was a bubble. And then I came out into the world feeling like I'd just done this very unique traumatic thing that no one had any concept of, and then just was faced with this onslaught of strangers just asking intrusive questions, and I felt really obliged to answer everyone I met. I think early on it was interesting to me that it felt like when I went into any space, for some people, they had to address the wheelchair immediately. They were so anxious about it, and they had to ask me, what happened? What's wrong with you? Why are you in a wheelchair? Is it permanent? Kind of a wide array of like those sorts of questions.
And you just wanted to be met as Grace. Hi, Grace, I'm Julia.
Yeah, completely.
How's your day? Like you would if you hadn't been in a wheelchair.
Completely. I didn't think I was asking for much to just be treated as a regular person, but it was really interesting to me how often I was asked these questions. And what I hated the most was when I would tell them what happened, the reaction I would get. I felt like, I say in the book, I felt like they had come into my world and sort of spat on it. That's what it felt like a lot of the time, because they would
the pity. Was it the pity?
Yeah, it was a constant, how tragic, how awful, just projecting a lot onto me that I then felt like I had to carry. Yeah.
I get why people say how awful and how tragic, because there is truth in it too. But I think what none of us realize is that when we say that, we pass our feelings of burden, of tragedy onto you, and then you're left carrying it. So is there a way of acknowledging that this is a difficult thing for anyone to have to negotiate and live with without splitting on your world?
Yeah, absolutely. I think for me, when I'm going through the world, I think a lot of people view me as still being in a state of acuity. It's like it's just happened to me, and they're imagining if it had just happened to them. And I'm 6 years on now, and I don't really think about my injury that much. It's just my life. So I think that's something that people instantly want to react to. I'm much more open or much more willing and happy when people ask me how I navigate certain places, barriers, showing an interest in my like current life, I think. And I think then you get a much greater appreciation of the difficulties.
And so what are the difficulties? I want to know.
Being a wheelchair user is a constant reminder that you are not designed for this current world. Mostly everywhere I go is I can't use the toilet, I have to be bumped up a step, or there's no ramp, or I can't fit through the doorway, or there's some sort of health and safety regulation that means I can't exist in that space, or the lift is broken, or the train assistant doesn't get me off the train on time.
Oh, all of that must be so crazy making. Like wanting to go to the loo and not being able to get into the loo.
Exactly.
Those urgent things.
Yeah, and it's what I really struggle with the toilet, the bathroom things, is that it's like, it then feels like I don't have any privacy, because I have to ask them if they have a disabled toilet, and if they don't, someone in a shop or a restaurant will suddenly start thinking about me in their current toilet and saying, oh, I think it will work, and I think we'll do this, and it becomes this huge thing that
and you just want to go to the loo.
Exactly, and I don't think anyone wants like a huge discussion around whether they'll fit into this particular bathroom. It just feels like there's this lack of privacy in general that disabled people are offered.
And it's such an intrusion.
Completely.
And tell me about Nathan and how, if you're up for it, how you've renegotiated your relationship.
Yeah, I think what gave us such a strong start after my injury was just the absoluteness of that he was experiencing this too with me. He was there, the first day, and then didn't really leave my side until I left hospital. He moved in with my parents because we were living on a boat at the time that obviously wasn't going to be possible. There was this just certainty that this was a thing we were dealing with together. And sure, I was dealing with it more physically, but he was completely there with me.
That commitment to you of love.
Yeah, completely. And I think that kind of unwavering support set us up really well. But there were lots of challenges to navigate, I think, because suddenly you're introducing an aspect of care into a relationship that didn't really have that before, in the physical sense of sometimes he needs to help me into a car or downstairs or lots of things. And that was quite difficult to navigate at first because it's never something I had, or he had, or I especially had experience with. And you're trying to balance having a romantic relationship, but also this sort of need for assistance.
Care.
Yeah, exactly.
And that sort of feeling that you're a burden rather than an equal.
Yeah, exactly. I think that was something I had to work through as well. And I know lots of disabled people that do that. And I think I felt so grateful though that it was Nathan helping me with things. Lots of disabled people have to have carers come in every day that sometimes they don't know, and that must be so intrusive into your life. And so
if they're late or they don't show up, you're stuck in bed or whatever.
Exactly. It's completely strengthened our relationship in ways and deepened it, I think, because we've had to have really difficult conversations, or it's things like if we're having an argument, he would still like midway, if I need to get off the sofa, obviously would still do that. So it's an interesting space to navigate. Yeah.
And the romantic side in your physical relationship, I imagine you had to rework that and find ways of being close and intimate that still worked for you both.
Yeah, absolutely. And I think for me, that was a real challenge, because not just because of the injury and that kind of changed the way my body feels, but also just I felt like I had a lot of experiences in hospital that felt really intrusive, felt really uncomfortable, painful, felt like I didn't really have any dignity or choice.
You didn't want to be touched, like being touched triggered that trauma from the hospital.
Exactly. And that has taken years, and I think I still have remnants of that. So that felt like a really huge hurdle, actually.
It's more in a way than the injury. It was the trauma of your treatment post-injury.
Yeah, absolutely.
That you were a body, not a person, and people just did stuff to you.
Yeah, that's what's sort of stayed with me, I think. Yeah.
But you've overcome that together and find ways of being close. And
yeah, definitely. And I think he's been so patient, but I had a therapist that was really keen on me finding ways to feel physically good again, because I felt like I just had 10 weeks of feeling like I was just a body of outputs and inputs. And I remember my therapist asking me early on, like, what feels nice for you? And I couldn't think of anything. I couldn't think of anything recently that had made me feel
pleasure.
Nice. Exactly. So things like introducing swimming back into my life and other things like that, it's really helped that
expand your pleasure receptors.
Exactly.
And now you're working as a doctor, so you finished your training, and being a doctor in a wheelchair, patients treat you differently, other medical professionals treat you differently. You're bridging both worlds.
Yeah, it's a really interesting one. And I think right after my injury, I just didn't understand how it could be possible. I'd never seen a visibly disabled healthcare worker in my life.
I haven't. You're the first I've met. I'm 65. I have never met one.
Exactly. And I think that's most people's experience. And my university were really supportive. They came to see me on like day 3 of HDU and they said, we'll support you. I felt lovely, but I just had no confidence in these two able-bodied men telling me this. So yeah, it was only when I found a doctor in Scotland who was also a wheelchair user, I just felt like it unlocked something. It just took one person to know, okay, someone else in the country is doing it. Yeah.
And that's what you want to be the role model for others.
Yeah, absolutely. And I think when I started doing some speaking, lots of young disabled people reached out to me and said, oh, I was told I had to stand to be a doctor, so I didn't apply, and all these things. And it made me feel so sad, but I felt so lucky because all the wheelchair user doctors I know, and I've tracked down about 7 now in the UK at least, I think vast majority became disabled during medical school. And that seems to be the way. And I think young disabled people, if you can't see anyone like you, exactly. Exactly.
What are the challenges and what supports you working full-time as a doctor?
It's like I said before, it's hospitals are supposedly accessible, but that's all the patient areas. The staff areas are not, and it's just a reminder I wasn't meant to be in these spaces, really. So that's interesting. It's just another thing to happen when you're sort of just trying to do your job, which I find really frustrating. And I found some of my colleagues' reactions to me the most challenging. I find patients have been fantastic, but do
they feel like you see them more, given that you've been a patient? Do they feel like there's a bridge of empathy? Or
especially with disabled patients, there's this kind of scaffolding of understanding that is already there, that's already
unspoken.
Built. Yeah, which is lovely. And for example, I did a psychiatric placement in my second year of foundation training as a doctor, and it was in an inpatient ward, and staff were very anxious about me and my safety in particular as a wheelchair user, in that they thought I might
not be able to get away.
Yes. So it meant I had to take some time off this job and just wait for them, and then they arranged it so someone would accompany me everywhere. I thought it was a bit over the top, but I completely understand where they were coming from safety-wise. But it was so funny to me because when I did start, the patients were lovely to me, much nicer to me than any of the other staff. And I think it's something about being a bit different. I almost can de-escalate a situation just by existing in it, because they don't quite know what to do with me or maybe how to talk to me, and I'm a bit of a different person for them to interact with.
This is a shorthand, but I guess if they're vulnerable, they often see doctors as holding all the power, and maybe they see you as that you're going to have more collaborative power because you've definitely been a patient too, and so that there's a sort of sense of, she'll be more on my side, I don't have to fight her so much.
Absolutely. And I even sense that kind of physically. So, we'll be going on a ward round, on a medical ward, and I'm already eye level to everyone that's lying in a bed. And sometimes I'm with a poor consultant that's like very extremely tall, and they're having to tower over and try and bend themselves to be smaller. And that is already, that dynamic, I think, changes things.
It's more equalizing. So then the other professionals that you're working with are more of a challenge for you. What's that experience?
I think it's just, for most colleagues, this is the first time working with a wheelchair user. So I find that sometimes there's a discomfort, sometimes there's an anxiety at the start, and that means they end up saying something not great. They're making a joke or trying to normalize it in their own way, but actually drawing attention to their own anxiety. It feels like a lot of the time I'm telling people, don't worry, it's fine, it's okay that I'm a wheelchair user. It's okay. Like, I'm trying to comfort them through their own reaction.
Very annoying.
Yeah. And I found, especially going back as a medical student, I did find it really tricky because I just wanted to get the same experiences as everyone else. But I did feel like sometimes senior colleagues would sort of allocate the other students, and then they'd think, oh, we'll find something for you to do, Grace, as well. And so I constantly felt a little bit sidelined. But that meant when I did find a senior doctor that was really keen for me to get the experience. It felt so much more special and
a
valuable.
family. So do you have a specialty you're going to go into? What are you?
Yes, I start paediatric training in September.
So you're going to look after children?
Yes.
That's a wonderful thing.
Thank you. I'm so excited for it. It's sort of all I've ever wanted to do, really, since I was about 15. But interestingly, I find actually that kids are really great with the wheelchair as well. So it feels like that's almost a bonus that I'm getting.
They're much less judgy, make many less assumptions, more curious, more open.
Absolutely. More questions, but then you answer the question and they go, okay, that's just
Fine, got that.
how you live. Fine. Yeah, exactly. Which is really refreshing. Yeah.
You've really built your life around the difficulty. I can see that. And you have a very good functioning life. You've written a book, you're a doctor, you're qualifying, you're in relationship, you go out, you have fun, and you still have extra challenges that able-bodied people don't have. What are the things that you really want us to know so that we don't mess up each time we meet someone like you?
I think what I really wanted to get across in the book was...
Which is called, everybody, To Exist As I Am, a doctor's notes on recovery and radical acceptance.
Thank you, Julia. That's helpful. I'm trying to get better at advertising it. So I think what I really wanted to come across was that I don't always get it right still. You know, I don't want people to feel like, you know, I'm speaking from this perspective exactly. I absolutely get it wrong still with other disabled people, with lots of things. So I think for me, it's trying to reduce this anxiety around disability. And I think ways you can do that are, for me, actually, it was started by just following disabled people on Instagram and social media, just filling my feed a bit more with other disabled people with different disabilities and understanding the real nuance of disability, that it's different for everyone. And I think I really want people to feel less anxious, but also feel comfortable being open with your own lack of understanding and bias. So lack of understanding, I'm so fine, you know, I'm very happy when someone says, oh, I don't know how to help you, can you let me know if you need help, or I don't know the right word to use, what's best. Much happier with that. And I think it's also what I feel like I had to do in rehab, really, is confront my own bias and stigma that I had about disabled people, that I felt like only sort of came to the surface once I had my injury. And I think
your bias was?
Well, I think I'd been at medical school 4 years, and I'd like to think I was going to be a really inclusive medical student and doctor. But I think I did think that disabled people had a lower quality of life, because I think that's what I was taught, and that's what I grew up seeing on TV shows and films when we were the butt of the joke, or a tragic story. And it was really uncomfortable to confront that bias, but I think you have to confront it to move past it.
And so when you talk about the way to confront it is with radical acceptance, what does that mean?
So for me, acceptance didn't feel like enough, what I was doing, really. I felt like I wasn't just accepting my injury, I was jumping in.
Because that's more like submission. It's like, I give up.
Exactly. It was finding this community, it was jumping in, it was learning about disability theory and disability history. And for me, it was really subverting what I had been taught about disability, and actually looking critically at society and the environment I existed in, and how that perpetuates these narratives of disability, that it's a tragedy and that your life is much smaller now.
Yeah, I really feel the expansion of that if I can change my own narrative around what I think about myself with things that don't work, but also with other people, not from I'm less than, but I am who I am, and I can expand my life given that is who I am. And actually you can use that lens in many different ways. So it's a very expansive way of being.
Absolutely. And I think for me, it was also, I stopped internalizing what strangers would say to me or what people would say to me on the street or wherever, and actually realizing it was a projection of their own ignorance. And that was really helpful as well, that I felt like I could suddenly brush these things off a bit more. And I noticed the more I felt like this and became more confident, people's interactions with me changed.
Tell me more about that.
I rarely get asked now what's wrong with me or what's happened to me. And I
That's
think,
interesting.
yeah, and it
So you're
happens.
projecting something different that they don't.
They don't maybe feel like they can do that anymore. Or they can't say, oh, how sad for you. And I still get the odd comment, but it upsets me that I got a lot of these people talking to me like this when I was probably at my most vulnerable, just been discharged, felt really had no confidence in myself. But it is interesting to me, yeah, now how people have changed in their interactions to me. And I think part of that is me setting these boundaries in my head of the way I would like to be treated and the way that it has crossed a line, and when I will say something to someone or call them out on it.
How do you call them out on it? So if I said to you, I'm really sad for you, what would you say to me?
I find it really challenging because I'm very happy to be quite bold if it's in the street or wherever. I feel like I can just snap something, or I can say, well, I feel sorry for you, or I can just say, no, I'm, fine, and I can brush it off. But it's much harder when it's in my work environment. And I find that really challenging, particularly with colleagues, because patients, I give a lot of grace to patients because,
they're
of course,
suffering already.
exactly, and they might be going through their own big health change or physical change. So that's kind of different. But it's with colleagues, I find it really challenging because I'm also someone that really likes to make a good impression all the time and please people. But I still find it really hard to balance those things. And I think often I just let it slide, which sometimes I have to, I think, but it does frustrate me. Yeah.
It's really interesting, isn't it? Because I work a lot with grief, and as you've described, you've grieved a lot. And when I was thinking about you, I was thinking that the thing that makes a difference is the support and love of others that enables us to survive whatever the loss is, whether it's someone died or a physical injury that changes our life. And so that one does want the emotional support. But I think what is new for me understanding from you, there's an attitude and a frame about that emotional support. So how I said this is sad could change it radically from being something that supports you to being something that patronizes you. And one you want to punch my face, and the other one you can receive and take in. And somehow it's almost like how I say it as much as the words.
Yeah, absolutely. And I think, for example, a while ago, I was at the Hampstead Ponds getting ready to go for a swim. And that's sort of like, I love it there. I'm always so happy to be there. I was just looking forward to my swim, and an elderly lady was changing near me, and we just start talking. And she's asking me what happened. And now I'm very happy to just brush it off, or just say no. It's a long story. But she kind of kept pushing, and then she said, it's just awful to be in a wheelchair. It's just, I kept saying all this stuff, and I felt like, God, like I'm actually in such a good mood right now. I'm in my place that I love going to. Yeah. And it just made me think it's so interesting that people can say it like this, because I just think I wouldn't say to her, oh, isn't it awful being old? I can't imagine that. How terrible for you, or whatever thing you could say. And so I find it like a funny almost sometimes, because it feels like such a weird glitch that it's allowed for anyone to say, well, then you can say how tragic it is, and then talk about someone that that was in a wheelchair for 6 months or whatever. So I feel like I don't take it in now. I can just laugh
can screen.
I can screen it, exactly.
So where can people find you who want to know more and discover more?
So I'm on Instagram mostly. That's where I post things that I write and where I talk about most things, at Grace SG. And then I'm on X and Blue Sky, just my name, where I share. I'm trying to do more writing now I finished the book. I feel like I have space now to write about other things. So hopefully we'll have some more projects coming up soon.
What did you learn from writing the book?
Yeah, I think the book writing itself was just a huge piece of the recovery. I started writing it actually from as soon as I could open a laptop again. I was still in acute care. I just moved to sort of the acute stroke ward, actually, is where they put me at the Royal London. And so I just started writing everything down as a way to anchor myself to this strange new reality I was living in. And then I just wrote for the next 3 or 4 years every day.
And so do you recommend that to other people if they have something similar or different that happens to them? Just journaling, writing, getting words on a page.
Absolutely.
Finding your voice.
Absolutely. And looking back, it's funny to see it now because a lot of it is so confused or angry or upset or muddled.
Distressed, yeah.
Exactly. But I think you have to put it somewhere, and I could hold it there on this Word document, and that was really helpful.
And now that it's out in the world, your book, what do you hope for it? What's your dream?
I wanted to write it as a book that any person could read and get something from it. I think I really had young disabled people in mind as well, because it's the book I wanted when I was first injured. I wanted something that wasn't this individual story of disability where they're climbing a mountain or they're just which is each their own, but that felt like the really common theme was this. And I wanted something that felt bigger than me and was about community and a movement and
activism.
Activism, exactly. And as you say, something that could relate to other people going through a completely different change.
Yeah. Thank you, Grace. It's been a lovely conversation. Good luck with all that you're doing.
Thank you so much.
Particularly as being a paediatrician, I think the young people and children you'll be working with will be very lucky to have you as their doctor.
Oh, thank you so much, Julia. It's lovely to speak to you too.
Hello, Sophie and Emily. We are going to talk about Grace Spence Green, who I actually read her book and wrote and asked her to come onto the podcast because I was so moved by her story and her relationship to it. She gave me a whole take on disability and injury and that I'd never fully heard before. And I just thought it was fascinating.
I really loved listening to her, and I had lots of different thoughts, but one of them was the idea of sort of inclusivity in society. And so often it's not that there's something wrong with the individual, it's really the environment that makes it difficult to exist. And that's true of having physical disability, like being in a wheelchair, but it also made me think of lots of neurodivergent young people that I see in my practice and are really, really struggling with mental health issues. And it's really not because of their diagnosis of being on the spectrum or ADHD, is because the environment they have to exist in, like going to mainstream school that isn't they're not necessarily like getting the accommodations that they need or the support that they need. The environment they have to exist in really isn't designed for them. And then that creates a lot of anxiety, depression, low self-esteem, all of these subsequent comorbidities that actually aren't stemming from the diagnosis of like, oh, your brain works in a different way.
Yeah.
They're coming from the fact that you're a minority living in an environment that's designed for the majority.
For the majority. Yeah, that's very clear. That's so good.
I felt the pain of that description of like when the world keeps letting you know that you don't belong, that you're not supposed to be in these spaces, how to hold on to your sense of sort of right to be there, your power in the world, your right to take up space and exist, when that's the message you keep receiving is like, this isn't made for you, that you're not supposed to be here. And I know people get annoyed by the word privilege, and it's a complicated territory with all the conversations they have, but that is what they often people are talking about when they're trying to describe that, is the privilege of not having to deal with those sorts of daily barriers. Doesn't mean your life isn't hard and you don't have challenge, but there are certain challenges you don't have just because you are part of the majority or you're part of the sort of power structure.
That you could step on a train, that you could go to the loo on a train without anyone helping you, that you know, those images of her having a fight with her partner. And halfway through, he has to lift her and take her to the loo and all those kinds of things. There's something about the mountain of difficulties to climb, and yet somehow having this capacity and grace to climb them and reclaim your power and agency in your life. And in her case, be a doctor. But I'm sure there are many people in her community that are doing versions of that I find truly inspiring.
There's a real generosity, isn't it, in someone writing a book like that? Like that she was saying that her main message is to help people like us be less anxious around people who have a disability, both to like help us understand that our anxiety adds to the burden that they
What
carry.
she called spitting on her, like she
Yeah.
felt spat on. It's such a powerful expression.
Yes, and that the fear of getting it wrong, like I'm going to say the wrong thing, do the wrong thing, and our kind of fears around that lead to all sorts of quite hurtful and unintentionally harmful behaviours. That if we could all just, on all sides, she's had to learn to be more robust, hasn't she, about the world and how it meets her. So it feels more than right that we should try and learn to be more robust about getting it wrong. That kind of like in these sticky things where we just don't feel so sure of ourselves because we lack the experience or the knowledge. And obviously we can work harder to get more experience and knowledge, but in those ones where we might feel nervous, just be a bit more robust about, oh, I think I might get this wrong, but I'm going to try. And if you do get it wrong, not make that a big deal for them.
Oh, ask the question. That's what I got from it. Just ask.
I think most people are really, like, their intentions are good. But people are, like you say, so afraid of getting it wrong, and I'm sure I'm the same, that it sort of backfires. I think if you're worried about getting it wrong, like that's what you lead with. Like, I really don't want to get this wrong. Is there a particular term that you like or a way I can help you? That I think is just makes it easier for everybody. It's just like a transparency.
Yeah, and it's sort of taking responsibility for your part in the relationship of that moment of relating, isn't it?
Yeah.
Of like, I'm coming to this situation with this, not quite knowing, feeling a bit nervous, but want with a good intention, rather than somehow putting on her or on someone who's disabled to sort you out. So it's sort of like, I need to take responsibility of the fact that I might not know what's needed of me here. How can I do that in that dynamic?
And I think what I find interesting in that, and I agree, it's our responsibility. So rather than continuing to other them, like looking down and saying, poor you, and what a tragedy, but actually meeting someone where they're at and being curious and wanting
Those things
to
are
know.
assumptions.
They're such assumptions. And they're the assumptions that the world tells everybody. So it's not surprising that they're there. But to your point about mental health too, similarly, I love that in the psychiatric ward, the other doctors were very protective of her and kind of she couldn't join it for a while they were putting lots of kind of protections in place. But, safety. But actually the psychiatric patients saw her kind of openly and were so nice to her in a way that they weren't to other doctors.
What I was thinking when she was talking about that was just the powerful idea of making somebody feel more equal, which is just incredibly empowering. And I think in situations where you're in hospital or even just like at a doctor's appointment, most people feel really vulnerable and like this is the person in charge. And I think a shift in the power dynamic, like seeing somebody in a wheelchair and then therefore them being on the same level as you and you making assumptions that they must have struggled in some way, like assumptions that life is not always easy being in a wheelchair, I think might make people feel more able to kind of have a voice, to ask about their treatment, to question what's happening, which so often people don't feel when they're in a doctor's office or in a position where they feel like the less powerful person in the dynamic.
Yeah, because power and trust are very related, aren't they? If you're in a position of power in relationship with someone, you have the more potential to do them harm. It's a greater risk. You're more vulnerable in the presence of that person. And it made me think about it's like therapeutic relationships, right? Where a very similar power dynamic, it can exist. You have a lot of role power as a therapist. And certainly in my training as a person-centered therapist, there's a lot of thought put into how do I minimize that power differential? How do I acknowledge it, not pretend it's not there, not pretend that sitting in this chair and not that chair makes a difference, but also by being more human. Because one of the things that you said, like by being in a wheelchair, one of the things they assume is like, oh, you've had struggle too. And something by being human with your clients is like, you're a fellow flawed human being too, rather than a therapist sitting there knowing all the answers who must live a perfect life and is perfectly emotionally regulated and hasn't made lots of very stupid mistakes in their lives, which obviously is a complete lie. But being able to sometimes break through that is a moment of trust and
deep connection.
And sometimes it blows apart something that can be uncomfortable. With doctors, even more so than therapists, I think you want to think that they know and that they've got all the answers, because that's like, oh, then I don't have to hold it myself. But it's not a truth, so it's not a very helpful one. I'm not sure how much in the medical profession, and maybe Mum, you would know more, there is any conversation about power dynamics.
I mean, I taught at Mary's, for like 25 years.
That's right, I'm wondering.
Yeah, but I only know what I taught, which was like trying to have collaborative power and start with what do they know and then feed into that rather than start from a position of power and kind of top down. You'd hope there would be a lot of conversations about power dynamics, but I'm not sure that there are. I've had so many bad conversations with doctors over the last few years. I've left feeling so much worse than when I arrived that I wish they'd had more training.
Or just more people skills.
Yeah.
Or like just the language doctors use is so dehumanizing. Obviously, there are some amazing, incredible doctors out there.
I love doctors.
And Grace is obviously one of them.
Yeah, I'd love her to be my doctor or my child's doctor. Yeah.
I don't know a single person who hasn't had an experience with a doctor who might be unbelievably good at their job from a professional capacity, but delivers news or talks about you in a way that just feels like, am I like a person to you, or am I like this like
diagnosis
object?
This object, like particularly like around really sensitive things, around like sort of miscarriage or just like the language that doctors use can be so unbelievably like
incompetent cervix.
Yes, incompetent cervix, geriatric pregnancy. I mean, obviously, this is not their fault. This is just the medical terminology. Your embryo has stopped progressing. Yeah. That was like the one that and I was like, you mean it died? Stop progressing? Like, what is that?
It's not human.
It's not human, but obviously to the person who's got the embryo inside of them, it's a baby, however early it is.
One of the things I thought about after my conversation with Grace, that with my very wonky face, or as it improved, I actually felt there was nothing anybody said that I didn't find annoying.
Yeah.
So that if people commented on my face, I find it quite annoying. If people didn't comment on my face, I find it quite annoying. And now when people tell me, you look so much better, I find that quite annoying. But if they don't say to me, it looks better, I find that even more annoying.
There are no-win situations.
I always say my eye's still wonky. And other people say, no, it's fine. And then someone yesterday said, yes, no, it is a bit squishy. And then that really pissed me off.
I think that just sort of leads to like what I was going to say about this idea of that she talked about radical acceptance, which I think is hard to do and such a helpful concept. And like for her, it meant subverting the narrative. In DBT, which is dialectical behavioral therapy, there's like a whole stress tolerance thing about the skill of radical acceptance, which means really accepting something in your mind, accepting something in your heart, accepting something in your body. And it's essentially like, if you have a problem, you kind of go through like, can I solve this problem? Maybe you can. If you can, great. Can I change how I feel about this problem? Maybe you can. If you can, great. And then your other options, if you can't do those first two, you can either like sort of stay completely miserable, you can make it worse, or you can try and accept it, and that doesn't mean that you necessarily like it. The idea
Submit.
behind it is just to sort of reduce emotional suffering, really, when that are things that happen that are not in your control, that you can't do anything about. But by fighting it, you're sort of causing yourself more pain. If somebody breaks up with you, that is not in your power. You can't make them get back together with you. You can't make yourself like it if you didn't want to be broken up with. But ideally, you don't get stuck in the
loop.
It's not fair, like, how dare they? But you kind of eventually get to a place of, like, this is really painful. It hurts. I wish that it was different, but this is how it is.
I need that.
Well, I don't think it's ever linear, is it? It's like, I think probably you have like moments of that, whatever it is that you're facing, and then moments of like, fuck you.
Yeah, no, I agree. But I think that's extremely helpful.
It's a nice framework.
It's a lovely framework.
But it's really hard to do. I am rubbish at it myself.
But we'll put something in the show notes about that, because I think that's really helpful. But I just really want to thank Grace for being so open, for writing her amazing book, which I really recommend.
And I'm really looking forward to see her very rich, full life that may be different to what she imagined, but equally wonderful.
Yes, that was a lovely way to end. So thank you, Grace, and thank you both.